Welcome back. Inside today's episode, we're going to talk about one weird trick that's actually a little hack where you can save money in your health and fitness journey. Or if you're a coach or a health professional who's serving clients, this might be a great way for clients to budget for your services. And it all involves using health savings accounts or HSA on things like gym memberships, food, and potentially even coaching services. Now, there was recently a bit of a new sort of law passed or declaration by the IRS that essentially expanded the coverage of some of this HSA spending. Previously, this used to be a little more strict in terms of things like medical appointments, procedures, things of that nature. It was then broadened. You could use it for things like first aid kits, but now we're really seeing HSA accounts having a lot more flexibility in terms of the carryover to someone who's more interested in a preventive lifestyle medicine versus just Western medicine, right? So this is basically a way to enable clients to use their HSA or FSA, which would be a flexible spending account, for things like gym memberships, maybe even in some cases at-home gym equipment. Obviously, a lot of these things may depend on your individual company. So for example, Health Equity offers an HSA program, so you will have to submit things like receipts and stuff for approval, but things like recovery tools, first aid kits, there's a lot of different things that can be used that maybe previously would have been limited on an HSA card to just things like medical appointments. It may sound like a bit of a stretch, but because of this recent law passed in recent years, we're basically seeing a wider criteria of items that can be used that kind of fall under the umbrella of HSA spending. So today I'm going to talk a little bit about that criteria, and we'll also define a little bit, just for those who are less familiar, about HSA accounts, FSA accounts. This is largely applicable for my audience in the United States versus folks who are abroad or living in different countries. So first, an HSA account is going to stand for health savings. I mentioned that a little bit earlier. A health savings account is generally available with higher deductible insurance plans. The insurance company basically takes a portion of your premium and can put it in the HSA account pre-tax, or you may have a way to contribute separately. For example, companies like Blue Cross may have like an optional HSA that can be added on to things. An FSA, or flexible spending account, is generally an employee benefit or available for lower deductible plans, but fulfills a very similar purpose. So depending on what company you work for, who you work for, or whether you're self-employed or the insurance plan you've selected, you may or may not be eligible or a candidate for one of these things, or something that's been added on to an existing policy you may already have. Previously, the laws around the use of these accounts were fairly strict, meaning you couldn't go out and necessarily get reimbursed for certain purchases or even use the HSA debit card that they'll provide for you on certain items. It was very much where certain things were green light, other things were kind of red light or exclusion, that were kind of a no-no when it came to these health savings accounts. So now it seems as though there's been a much broader expansion, and you can look at all of this under the IRS publication on their website, and also assuming you have a letter of medical necessity from your doctor, which I'll get into in a little bit. But what we see is there's an expansion to include things like fitness goods and services. This would be things like gym memberships, home workout equipment, wearable tech. So for example, like an Oura Ring involving HSA there, body weight scales and other devices that keep track of things like scale weight or body composition, potentially even services related to coaching. Now, the coaching would have to be approved as like an HSA provider, if you will, or an HSA-approved option. And there are ways to do that, but that's beyond the scope of today's episode. Another thing you could look into is sleep assistance. So for example, for folks with sleep apnea, CPAP machines may fall into this category. Things that are mattress pads, special mattresses, or things like Sleep Me or 8 Sleep might fall under the category of these new HSA spending policies. Also mental wellness items, so things related to meditation, mental health coaching, or therapy could potentially fall into this new category as well. Recovery tools and other items that may aid in certain conditions. So this could be certain massage guns, massage services, massage devices, potentially even looking at light therapy for seasonal affective disorder. This would be especially relevant if someone had low vitamin D status, or you live in a geography where you're not in close proximity to the equator, or you have much colder, darker seasons during certain parts of the year. So other things we may include here, just to kind of round out this list: supplements, may fall into this HSA category. So we can kind of expand to include that. Now, not all supplements are necessarily going to be included yet to where you can just go out and use this HSA debit card. In many cases, you're having to shop with specific companies and then get reimbursed. And usually, the larger the company, it's more likely they have these kind of HSA platforms set up versus, you may not be able to go to like a mom and pop supplement shop in your hometown and have your HSA card approved or being able to get reimbursed that way. Itemized receipts are also a big thing. I've done this a few times with various things I wanted to keep around the house that were related to health or first aid, and using an HSA card there, it was very important to have those, itemized receipts and things that are very clearly related to health. Another thing we can do to use an HSA account for these things is getting a letter of medical necessity. And you can do this through your doctor, and this also, may require you to find a little bit more of a progressive primary care physician or someone who's at least open to more proactive solutions related to your health. There's also a little bit of like certain consumer facing services that may provide those medical letters of necessity. But as always, if you have a good relationship with your physician, go to your doctor's office and try to get that letter of medical necessity, especially if you're someone who is trying to actively lose weight, improve your body composition, things like that. If you're already healthy, maybe you can make the case that this is helping to kind of cement that effort and to keep you healthy, and it's serving as more of a preventive thing, or maybe it falls into one of those buckets or categories that I mentioned earlier. In any case, if let's say you're a health coach or fitness professional and your client has a condition where a certain service or product would be very helpful. So maybe if someone's experiencing physical pain, like something like rheumatoid arthritis, maybe there's certain items that kind of fall in that category. If someone is overweight or obese, then maybe something related to like the scales that we discussed and monitoring body composition and weight loss, potentially, using something like obesity as that diagnosis can be used for many different things, and you basically can advocate for the doctor to write a letter of medical necessity for the gym membership, and that would allow the person to use HSA dollars. So in many cases, you're not just going to be able to like go to the gym, bring an HSA card, or buy it on your regular credit card and get reimbursed by your HSA company. In many cases, you're going to need that letter of medical necessity from the physician. Similarly, if a client is significantly strapped for time and cannot afford healthier food under normal circumstances, the doctor might even write a letter of necessity for meal delivery services. I think that one is a little bit more of a stretch compared to some of the physical goods items or more conventional medical services. For example, like massage has frequently, I've seen this both with clients and my own experience, things related to recovery, chiropractic, those things will typically be approved by HSA versus something like a gym membership or meal delivery service. You may need that letter of medical necessity from your doctor. Now, as far as the details go, letter of medical necessity has to be written for each single item. It's not one single letter that would basically be all encompassing that you can use for everything. Instead, you would have to have a letter for the gym membership, right? This is going to support Bob or Jane Doe in achieving weight loss, and because of their current health status, that's going to be helpful for them for XYZ because of this condition. Insert whatever label. Think of similar to how under Western medicine, there's basically a standard of care underneath insurance and certain sort of diagnoses or labels that are used. Part of that is essentially creating that standard of care criteria. Now with HSA, you may need to essentially have a condition, maybe it's prediabetes or metabolic syndrome or certain things that's allowing the doctor to basically feel comfortable writing that letter of medical necessity. Now, not all HSA and FSA accounts are the same. I mentioned this a little bit earlier. So definitely check with the administrator of the health account just to see what the stipulations are surrounding your specific one. In some cases, even without that letter of medical necessity, you may be able to basically submit a receipt for reimbursement and they will review it. And if your doctor's unwilling to write that letter of medical necessity, you may be able to seek out alternative care options, get a second opinion, or there are consumer-facing services for this. Now, some of these independent services will connect you with an independent licensed provider that will assess whether metabolic health interventions can prevent or reverse disease, either preventing diseases that you have a risk factor for, or maybe reversing things that you've already started to develop. So in many cases, this may unlock HSA or FSA spending on those items. Now, the perk of HSA in the United States, right, is when someone's making this contribution to HSA, they're able to essentially deduct this from their tax liability. So HSA accounts in that sense and HSA or health savings have the ability to grow almost like an investment account, and something that might be worth discussing with someone like a financial advisor, financial planner, or accountant that you work with in terms of your own individual financial circumstances. So not everyone may find that this is the best way to go for them, but it is sort of a unique workaround in some cases. And as someone who's worked with a lot of clients over the years, I find that anytime someone can either potentially save money, or in this case, they're kind of budgeting in that HSA, or maybe their company that they work for is, contributing to that HSA, they kind of view that as like they're getting to spend someone else's money versus if they are investing their own dollars in their health. So just be mindful of that. I do think if there are coaching services using HSA, FSA, we still want to make sure that's being done the right way. So in some cases, physicians may be totally open and amenable to that request for the letter of medical necessity. But if not, there's a lot of third-party services emerging online that may, create that letter of medical necessity for you and allow you to do some of this HSA shopping. If you're not super familiar with different items, there are HSA stores online that can give you a better idea. So for example, certain medical devices like a CPAP, or I've even seen defibrillators for both adults and children, certain items that maybe you're ordering from like a telehealth pharmacy. There's really been a pretty vast expansion of what we're using this HSA account for. I think that's amazing, really opening up options for people in terms of their health. As someone, I have relatives or family members who are in need of things like EpiPens, right? Being able to use the HSA for things like that. Very, very helpful. This is true for both prescription and non-prescription items. Sometimes, being able to use these HSA dollars for different health tests, things of that nature. If someone's pre-diabetic, maybe for a glucometer, all of these devices are really going to go a long way in terms of someone's, overall health and lifespan. So I hope you found this information to be helpful. I generally talk about when we're looking at someone's health and we're looking at someone's lifestyle, this is so much more than just macros, sets, reps, training, etc. Exercise and nutrition are a great foundation, but we have to build on that foundation. And usually when we begin pursuing optimal health, it involves discussing someone's entire life. And so even though HSA is sometimes lumped into the category of insurance or finance even, or taxes, it is something that can be used in your health and wellness journey to get healthier, live longer, and improve your quality of life. So I thought it was worth referencing on the channel. Some people were unaware of it. I think it's a great tool to be aware of and mindful of. I've personally, had an HSA in the past and something I will use from time to time. So certainly worth exploring if any of this resonated with you. Remember, if you have a condition that could benefit from exercise, or you're someone where some of these specific devices that I mentioned throughout the episode are going to be very relevant for you, you can do that. There are larger companies, for example, different wearable technology companies, have already gone and gotten that approval for HSA, FSA, so then you're not having to go get that letter of medical necessity, but typically that needs to be listed pretty clearly on their website. And again, always check with your individual health savings account or on that kind of IRS page in terms of the new law and expansion of what items are sort of included on there to be safe, right? Nothing in this video is necessarily medical advice or substitute for it, and I can't necessarily determine what your physician may write for you in terms of a letter of medical necessity. Just wanted to give you guys some example categories or buckets where that might potentially be helpful. You can use something like the different HSA stores online to get a quick idea and pulse on, hey, what can I spend this on? Because many of you may have that health savings debit card. Other people, you're going to be spending your own dollars and submitting those receipts for reimbursement. So that's typically how it works. That's how I've done it in the past. It's been something pretty handy, and I always enjoy being able to kind of save and then also allocate it towards my goals and my priorities, which are always very health, fitness, wellness, and nutrition specific. If you enjoyed this episode, learned something new, if it changed your perspective, gave you some ideas, if you're a health and wellness professional who maybe wants to, even incorporate some of this stuff, if you're in your own health and fitness journey and you didn't know about this and you learned something, please share it with a friend. Let people know about these accounts and the ability to use this. Ideally, we're all using it to get healthier and live longer. So Really, this information should only benefit people. If you're listening on audio, please drop a 5-star rating and review for the show. You probably found the show in the first place because one of my original listeners shared it with you. If you're on YouTube, make sure you subscribe and give it a thumbs up, and that helps to support the channel and continuing to bring you more no-cost content each week. A lot of folks will download the different episodes, or maybe they're even subscribed, but if you forget about those ratings and reviews or you don't share the show, we don't necessarily grow to reach that wider audience. So even though on audio we've had over 1 million unique downloads over the years, it's still tremendously helpful when people take 5 or 10 seconds, leave the ratings and reviews, because it allows other people like yourself who might benefit from the content to find the show in the first place and be able to dive in and consume some of the episodes. So drop the ratings and reviews when possible, leave a comment on YouTube, give it a thumbs up and subscribe. And remember to share the show and pay it forward with someone that you care about. I appreciate you guys tuning in, and I'll talk to you in the next episode.